Okay, so the next section in our look at the cardiovascular system deals with blood vessels. So what we want to do is kind of take an overview of things that all of the blood vessels have in common, and then look at the three individual types of blood vessels that also exist. Just as a reference, you will want to kind of have your textbook handy because there are some really good diagrams. We're actually on page 429. That's where it starts, this section. And the diagram that I like to use the most is figure 13.2, which has all of the different blood vessels in there, especially when we get into the different types. Okay, so taking a look at the blood vessels themselves, each blood vessel has three layers. The innermost layer is called the tunica intima, and it's made up of both endothelial tissue layer as well as elastic connective tissue. And the way that I remember this is that the intima layer is on the inside. The tunica media, anytime you see media, you almost think of the word medium, and that is the middle layer. It is predominated by a very thick layer of smooth muscle. Okay, and then the outer layer is the tunica externa, and so obviously externa sounds like external, and it is there to help stabilize as well as anchor the blood vessels. So things will actually attach to this layer, which will cause the blood vessels to actually kind of stay in place as the blood is flowing through them. Sometimes you can see this, it's kind of the difference between a hose that has water going through it that's left without a hand on the end. It actually can kind of move around on its own versus one that has something that's kind of holding it in place, and it stays put. The fluid pressure on the inside does change slightly, so that actually causes our blood vessels to kind of wiggle and wobble. So we need them to stay in their locations, otherwise they can damage other tissues. Blood vessels are capable of a couple of processes. One is vasoconstriction, where the vessel actually closes down in on itself, and the other one is vasodilation, and the vessel opens. The best analogy of something that you already know with this would be your pupil. It constricts and it gets smaller, and it dilates and it gets bigger. And if you look at the shape and the difference, it's the diameter that's changing of these blood vessels, just like the diameter of your pupil. So it works very, very much in the same way. Now what I want to do is I want to take a look at the three different types of blood vessels that we have. And the first one are our arteries. Arteries travel away from the heart. And that's another way that I remember, one of the key characteristics of arteries. We've already said we can't judge arteries based on the oxygen content of the vessel because of the pulmonary system where everything is flipped. So the way I remember this is arteries, A, travel away with an A. So A and away for artery. We have three types of arteries, and you can see those in 13.2. They do look a little different from each other. The first one are the elastic arteries, and these are our largest arteries in our body, things like our aorta, our descending and ascending aorta, the aortic arch. So these are the really big ones. They have the ability to stretch and relax, and they have to be able to stretch and relax because the blood pressure inside of them is so high. When the heart pumps and pushes that blood out into the aorta, it actually has to stretch to accommodate it because otherwise, if it couldn't stretch, the blood vessel would actually burst. The muscular arteries are more medium-sized arteries, so they're a little bit further down the line. They actually have a very thick layer of muscle, which helps to keep the blood actually going at that high pressure rate through the arteries. The last area of the arteries are called the arterioles, and they only really have a muscle layer with a very thin endothelial layer on the inside. So mostly if you look at it, it's the tunica media only. Okay, so all arteries, in comparison with the veins that we'll look at in a couple of minutes, but if you look at the diagrams, you can see all of their tunica medias are thicker than their counterparts. And like I said before, another distinguishing feature here is that they have very high pressure. So some key characteristics of arteries: they travel away from the heart, they have very thick tunica medias, and they have high pressure blood. So the blood is traveling very quickly through these blood vessels. Now, we're going to go kind of a little out of order, and you would think arteries would pair up with veins, but after you get through the arteries, you actually hit another type of blood vessel, which are the capillaries. The walls of the capillaries are what permit exchange with the bloodstream. In other words, the process of diffusion. Their walls are very small, and they are very thin. And this is important because this is the site of material exchange. We can't get any other material exchange happening within the body except at the capillary. So no material exchange takes place between the blood and the tissues through the arteries or through the veins. It can only happen at the capillary level, and that's because of the thinness of the walls. Those walls, like I said, are very thin, and if you look at figure 13.2, it's only the endothelium. There's only endothelial cells. Now, capillaries will form something that's called a capillary bed, and you can actually see a picture of that over on page 433 in figure 13.4, letter A. That's a capillary bed. It's this interconnected network that almost looks like a web or a piece of a spider web. So the blood, as it comes from the arterioles, which would be on the left-hand side of that piece, it actually has some choices. It kind of gets these forks in the road and can go to different locations. Basically, when it reaches the capillaries, the capillaries are so small that the red blood cells actually have to go through in a single file fashion in order to get through the capillary space. This is what connects the arterioles, which would be on the left, with the venules on the right. So the arterioles will go smaller and smaller until they reach the capillaries, and then the capillaries will join on the other end with the venules to start returning the blood to the heart. Now, the blood flow through the capillaries is variable, and some of that's because you don't always have a constant stream of blood coming through. Sometimes you get some blood coming through because it branches off, but sometimes they stay with the main branch. So you don't always have this consistent flow of blood through the capillaries. The last type of blood vessel we have are the veins, and they're kind of the opposite of our arteries. In veins, the blood travels through or to the heart, so it's making its return trip. And we classify veins based on their size. The smallest ones, which we've already mentioned, are the venules. And if you look again back at page 431, you see that it's mostly the tunica externa that is there. Then you move up to the medium-sized veins, which again have a thicker tunica externa than, let's say, the artery of the similar size, and they're about 2 to 9 millimeters in diameter. I'm less concerned that you know that exact size. The large vein, we only have 2 of them in the body, and that would be the superior vena cava that collects all the blood from above the heart, and the inferior vena cava that brings the blood below the heart. Now, for all of these veins, the walls of the veins are very thin compared to their artery partners. So if you compare the elastic to the large and the medium-sized vein to the muscular, you'll see the walls are much thinner in the veins than in the arteries. The veins also carry much lower pressure blood. In fact, by the time the blood gets to the superior and inferior vena cava, it literally almost just kind of falls into that right atrium. There's almost no pressure left by the time it gets back there. That's because the blood slows down so much when it's going through those capillaries. Now, to help with this, veins have a structure that arteries don't, and those are valves. And so the way I remember it is valves and veins both have a V in it. What this does is prevent backflow, and this is really, really important, especially in your legs, because you're fighting gravity all the time when you are standing. So those valves will shut to help prevent the blood from actually going backwards through the veins, like back down towards your feet. Now, a lot of our larger veins in the legs actually run through skeletal muscle areas, and so when we walk or we contract those muscles, it actually pushes on those veins and helps the blood flow return back to the heart itself. Now, sometimes the area around the valves malfunctions. It actually can become stretched and distended, and the flaps of the valve don't meet the way they're supposed to. This leads to what we call varicose veins in the legs, and you can actually see those like through the skin. It also can lead to conditions in other areas of the body that we call hemorrhoids, which are also not very pleasant to deal with. So those are the three types of blood vessels that we have and some of their distinctive features. You will kind of need to be able to compare and contrast them in terms of their physical properties and some of their physiology, their functionalities for your test on the cardiovascular system.